Now, what is patient-centered communication? Putting the patient first and allowing them to get more information, responding when they have questions, growing trust and empathy through the way we speak. All of these things are aspects of the software that we recommend. Our trust-driven care platform is education and software that helps build that self-efficacy with the patients that you see. How can you do that? Number one, make sure that all your communication methods are two-way communication. Don't settle for the easy game of one-way communication. Now, a lot of EHRs will tell you and EMRs will say, we'll send out automated patient or appointment reminders. Great. Except for the part where patients can't respond to them. I hate it. And that is a strong word, but I don't know if you hate this as well. When you get an appointment reminder from some group that you're working with, medical or otherwise, and as soon as you respond and they say you have a appointment tomorrow, 3:15, and you say, oh, I can't make it at 3:15. Do you have anything after 4? And all of a sudden you get a message back, oh, this line is not monitored. You cannot reply. What kind of communication is that? What kind of relationship does that form if you can respond to me, but I can't respond back to you? It's not patient-centered at that point. It's business-centered communication. So make sure that all of your communication is two-way. Email is two-way. Phone calls are inherently two-way. The text messaging service, if you use it, is it two-way as well? And does it come from a single identifiable number that clearly tells the patient it's your office calling? Or is it one of these things where it's multiple different numbers sending them messages all the time? That's not patient-centered communication. Secondly, patient-centered communication can be providing more information based on their findings, their pain, their condition, their concerns. So we offer the ability to build courses or education modules within our software and only open them up to people at the right time. So this isn't Dr. Google or YouTube where they can download a bunch of videos that have nothing to do with them. For me as a chiropractor, that somebody comes in with facet pain and they have watched 600 videos all about disc findings and numbness and drop foot and all these findings. It's irrelevant to them, but it's creating anxiety in them because they have too much information. So what I found works better is find the information they need and only send that module. So if they have facet-based pain, send the facet pain modules. If they have disc pain, send that. If they have headaches, send that information. But don't send all of it every time. Instead, we open it up at certain points for them to make sure they get the right information at the right time. Now, what does that do? That reduces anxiety because it helps them understand. And it's much better if it's you, the person that they saw in the office, providing the information. If you can't do it or you don't have the time, then make sure it's somebody warm and welcoming that's explaining aspects. Hey, you might feel pain when you do this, or your pain might be worse in the morning, and that's totally normal. Help people understand that. Again, with facet pain, people are always shocked when they have more pain just standing around. But standing is one of the things that really can make extension biased pain get worse. And I want to walk people through that and let them know what's going on. Anyways, we can use all these features of our software at trustdrivencare.com to increase that patient-centered communication, build that trust and empathy, and grow your office with people who love what you do. They want to only see you and they want to send all their friends. So how do you do that? We've got the tools, trustdrivencare.com. It's supported by the research, and I want you to have that bigger impact in your community, all right? Making more money, having bigger impact wouldn't be a bad day. In fact, that'd be an awesome time, and we'd love to help you get there. So check out trustdrivencare.com. Thanks.